Welcome back to Your Hour. Joining me now is Kathy Adkins, who is a dementia specialist. And I think that is significant because there are so many people dealing with dementia. Either they have it, or they have a family member or a good friend who has it. And the dementia, I think, really affects the caregiver as much, if not more, than it does the patient themselves.
I'm glad you brought that up because there's many studies out there that show that caregiver stress and caregiver poor health is tremendous. The life of the caregiver decreases dramatically because you think about if they're trying to care with someone with dementia, they have just now taken on a 24-hour day, 7-day a week. It's 365-day a year job. You can't go to the beauty shop, church, shopping, doctor visits. Everything in your life is your circle of friends, your socialization, your support system shrinks. People don't know what to do. They don't know what to say. They don't know what to offer. They feel bad about you being in a situation, but there's nothing they can do about it.
Right.
So it's a huge factor. And caregivers need tons of support from family, friends, church, community, wherever.
There are some organizations in town that actually offer respite for
Yes.
Caregivers, and I think not enough caregivers take advantage of that. They may not even know about it.
Most of them don't know about it, and then some of them feel like it's a privilege. It's not a privilege. It's a lifeline to
Yeah.
keep the caregiver able to function.
Sure.
So
So what kinds of health issues occur with some of the caregivers?
increased eating, smoking, alcohol, your level of immunity drops, depression is increased. Every health issue you have is magnified because you're not attending to your health because you don't physically or mentally have the energy to do so. So everything you have maybe increased weight, maybe losing weight, you're lacking sleep, you're making poor decisions. They might try taking some type of over-the-counter or prescription sleeping medication, and then we have people up in the middle of the night who actually are asleep but are walking around, and some of them out driving on the streets that are still under the effects of a sleeping medication. That's well documented. So it's a never-ending cycle. Respite care at least gives that person some time away from that to catch their breath, and they need to ask for that. It's not a privilege. Everyone should have that.
I agree. And you know, when you're taking care of someone who has dementia, if you're ignoring your own health, I sometimes say that dementia is contagious because eventually you start mirroring that type of mental health.
That's the behavior you deal with 24 hours a day, and that if you're on a desert island and you're with a group of natives, you're going to start acting like that group of natives. That's the only thing you have to interact with. That's why it's so important for people to have outside influences from somewhere that's coming in and helping. So you have someone, a support group. There are lots of dementia support groups. They're online. There's there's Lewy body support groups because there's 14 different dementias.
Oh wow.
Things that are specific. They all can have different names and start different places. They all end the same place. But along the road, there's little tiny differences that people need to know. But there's lots they can do. There's the Alzheimer's Association,
Right.
which is one of the 14 dementias. They have 24/7 people that'll answer the phone and talk to you and so forth. Most churches have some type of support system. There's a lot of support out there if you just ask for it.
MHA has a program, a mentoring type program that can help give you a break. And then it used to be, it's Humankind now, but it used to be, I can't think of the name of it, what it used to be. But they had a program, and I think they still do, called Faith in Action, where they can give you respite. You can go get your hair done, or go keep your doctor's appointment,
Yes.
or something, and they'll keep that person company.
Yes, yes, that's why your community, your faith community is so important, because there's help out there. You just have to ask for it.
Right. And you should not be ashamed to ask for it.
No, not in the least. CPAAA, Central Plains Area on Aging Agency.
Yes.
Terrible name, but wonderful organization. They have people that can help. You can call them and get some help from them. But there's help out there.
Well, thanks for joining us today,
Thank you.
Kathy. It's always a pleasure.